Go.
Well, living in a small town comes with many benefits like little traffic and low crime, but these same towns may lack enough doctors to help everyone.
In today's Focus on Your Health, Teresa Snow explains what's being done to change that.
Focus on Your Health is sponsored by MU Healthcare.
After 4 years of college, 4 years in medical school, and 3 more years in residency, many physicians choose to practice in a large urban area or at an academic health center like MU Healthcare. But there's an innovative program to help educate new doctors on how to navigate the challenges of a rural practice. Michelle Kenney is no stranger to life on the farm.
Classic American kid we did 4-H as children.
Michelle grew up on this farm in northeast Missouri, and that drives her personal mission to improve the health care of people in smaller communities.
I feel like everyone should have good care, and that it should be available and not something that's only granted to people who live in an urban area.
But few of her peers are following the same footsteps. In Missouri, only 18% of doctors practice in rural communities, while nearly 40% of the population lives there. This map shows how widespread the problem is. According to a 2017 report by the Missouri Department of Health and Senior Services, 99 of the 114 counties in Missouri have a shortage of physicians. To help solve this problem, the University of Missouri School of Medicine has started a rural residency opportunity, a new arm of its innovative rural health education program. Resident physicians like Michelle can get hands-on experience with the clinical and business sides of rural medicine.
It is a good win for physicians because the physicians understand what their life is going to be like.
It's not so scary, and seeing that it is something that could fit for me.
Can you show me where your heart is?
In addition to spending time in the clinic, resident physicians take part in a lecture series, hearing from others who chose the same path.
They have to be much more independent because there's less specialists around, and we just want them to understand that. So when they go there, they stay there to practice.
Resident physician Michelle Kenney joins us now. And Michelle, after undergraduate, medical school, 3 years of residency, it's been a long road.
Yes.
You finish up soon. What's your next step?
Yeah, so I'll be moving back to Kirksville, where I'm from, and joining a rural peds clinic up there.
And what parts of this program helped you make that decision?
Yeah, so I was able to be in the rural program in medical school here and residency, and I was able to do rotations in Kirksville and other rural areas and just see what it was like practicing in a rural setting away from an academic center.
A lot of physicians choose big city life, not rural city life. What advice do you have for them?
Yeah, I think that's something everyone thinks about, but it's worth trying and just seeing. I think they'll be pleasantly surprised the resources that are available and just the patient interactions they'll have in a rural setting, and it's worth trying.
Small town life is pretty good, isn't it?
It is.
Thanks, Michelle. With Focus on Your Health, I'm Teresa